Right now, though, the Victorian Government has announced a new permanent mental health hub, which will be established in your region, providing support without the need for a GP referral or eligibility criteria. So it's expected that the hub will be established in Benalla, Wangaratta or Mansfield in the coming months. And this will be among the first 3 that will be opened in Victoria. There are more to come as well. These permanent centres will eventually replace 30 temporary mental health and wellbeing hubs, which were established late last year in the wake of the pandemic. Mind Australia currently runs 13 of these hubs, including in Wodonga, Wangaratta and in Benalla. And the ABC's Charmaine Allison is speaking to Service Manager Rebecca Matheson Omondi about the announcement.
We're super excited. Obviously, we've spent 8 months doing the building blocks, putting in the hard work on the ground, providing services, from Mind alone to over 400 people, which equates to about 6,000 hours. So we were really hoping and expecting that the hubs would be extended because the work has really had impact across the state at a very grassroots level. So it's great news. We're thrilled, and we're also thrilled that the Minister has put in his media statement about the transition. So the hubs are sort of the front door service to mental health system, and they will be an ongoing permanent service transitioning into the new locals.
Do you know if Mind Australia will continue to run these more permanent hubs once they're established?
That's a great question, Charmaine. We're still waiting to hear the outcome of some tenders that we've put in for with the department, and we should be hearing any day whether we've been successful in that or not. So that would be really amazing for some of our teams in the hubs to transition across to these new locals. Obviously, they've done the groundwork. They know the local community. They know what the needs are, and can really just sort of hit the ground running, I guess, with no gap in service delivery.
Has Mind Australia been running all 30 of these temporary hubs across the state?
No, we haven't. Although Mind is the biggest provider of the hubs, we currently have 13 hubs across the state.
With these 13 hubs, how long have they been extended for, or does it just vary depending on how quick the transition will be to these permanent locals?
Exactly. So we know that the Minister and his team are committed to rolling out the new locals by the end of 2023. So we would kind of imagine a transition period for all the hubs within that time frame. That's what we're thinking. There's still some of the finer details of that to be worked out from our side, I think.
Why are these hubs so important, and why is it important that they continue?
As part of the COVID epidemic response, but also in response to the Royal Commission and some of the recommendations, we know that people have said the mental health care system is a very complex, hard to navigate system. These hubs have been removed a lot of those barriers to a very complex system. So people can self-refer. There's no eligibility criteria. They don't need a referral from their GP. They can just basically ring up and be connected to a support worker. And I think that that's the piece of the puzzle that's been missing in the community. If people are unwell, they have to be really, really unwell before they can access, mental health services. People can come to our service for anything. They can sit down and have a cup of tea and a yarn and talk about what's going on at home and their social isolation. They can come to us for support to access a GP. They can come to us for a range of things. They don't need to be in crisis. We're not a crisis response service, but certainly we can also support people and have supported people with more complex issues going on in their life as well. And it's important for this to continue. This is a real win for us in the community. This is the start of something that's going to be permanent, that's going to be easy for people to access, and they'll be able to navigate the system with support. So it's a really exciting time for mental health in Victoria.
And what kind of demand have you seen since these hubs have opened? And are you bracing for an increase in demand in the coming months and years?
Yeah, so I think, we've obviously seen a huge demand in Melbourne Metro, but also interestingly in regional Victoria. It's taken a bit of while to establish ourselves in the community and build up that trust so that people know the service is not going anywhere. But we've seen nearly 500 clients in the 8 months that we've been running, which equates to about 6,500 hours of support. That's a huge amount of support in the community. For those of us that have worked in mental health for years, we're really excited. We've been able to develop hybrid models across the state, so no one model is the same in all of these hubs, and that model is responsive to the local need. It's really unique, it's really dynamic, and it's just really exciting time.
That is Mind Australia Service Manager Rebecca Matheson Omondi speaking with the ABC's Charmaine Allison. 22 past right now. The